Thank you, Trevor, and good evening, everybody. It's really good to see you here this evening. Well, life can get us down, can't it? Feeling fed up, unhappy, down, disappointed can be normal reactions in everyday life. Some problem, some difficulty comes along, we feel down for a while, but often we get through it and it passes. But sometimes it doesn't pass. Sometimes it stays and it creeps over our lives. The feeling doesn't lift, the darkness begins to descend, and then it begins to interfere with day-to-day life. And for some, it takes over. And it's then that we begin to consider this whole area of depression. Depression is a very common problem. Currently, the rate of depression is around 2 to 5 people per every 100 of the population. So there will be people that you know in all likelihood that are suffering from depression. And more so, between 1 in 10 and even 1 in 5 will at some point get depression in their life. Throughout the length and breadth of Ireland, over 300,000 people are suffering from depression at the moment. This is a very common problem. And I suppose I mentioned that right at the beginning to encourage you, because depression can be a very lonely condition to deal with. When you're depressed, it can be a very lonely place to be. And yet there are lots of people who are struggling and suffering in the same way. But how do you know when it is depression? How do you know when it's depression and not just unhappiness? That's one of the questions that we often ask, isn't it? Well, depression is made up of certain symptoms. And if you have enough of these symptoms together, and they're strong enough, and you have them for long enough, round about a couple of weeks or more, without them lifting, it's what a doctor will call depression. The question we want to look at now then is, well, what are those symptoms? What are those features then that make up depression? How do I know when I've got depression or someone close to me is suffering from this condition? How does depression affect us? Well, depression affects us both inwardly and outwardly. Inwardly, it affects how we think and how we feel, and on the outside it affects our bodies and our behaviour. We're going to look then at some of those features now, just so that we can understand what this condition is. So let's look first of all at the outside. What are some of these outward signs then of depression? Depression causes symptoms in our bodies. One of the most common ones there, you'll see at the top, is sleep disturbance. Depressed person will go to bed and they won't get over for hours. They lie awake, they're worrying, they're often ruminating with very dark and negative thoughts. Or for others, the disturbance of sleep is at the other end of the evening, where they waken up early, and that's significant whenever it's usually a couple of hours or more than the normal wakening time. And by and large, the sleep with depression, it just isn't refreshing. You're just waking up in the morning and you really don't feel as if you've had a rest at all. For some, though, it's not that they sleep too little, it's actually that they can sleep too much and that they feel tired and drained and they oversleep. And that's another feature for some of depression. Another quite common one there is loss of appetite. The depressed person, they go off their food, there's no enjoyment, they pick over their meals, and it's significant, especially whenever there's weight loss, whenever you're not trying to lose weight. Again, though, for others, with depression, it swings in the other direction, and maybe more of us can identify with this, the comfort eating, where really in order to get something that just gives a little bit of pleasure, we eat more than usual, comfort eating. Well, depression can also cause a loss of energy physically. And again, it's more than just an ordinary tiredness that we get with a lack of sleep. With depression, it's a really drained, exhausted, washed out, fit for nothing kind of tiredness. Very often people with depression will tell you that their memory is going. They'll say, I just can't remember anything. And actually, it's not so much that their memory is going, it's actually that their concentration is poor. People with depression just aren't able to attend to things as well. So they'll come to something like this, and they'll go home afterwards and they'll say, I can't remember a fraction of what that fella was talking about this evening. And it's not that their memory is going, it's that they're not focusing as well, and that they're not taking the information in the first place. And because it's not registering, then they're not remembering it. And that happens with things like television and reading, and it can be a very handicapping kind of symptom, and one of the more common ones that we find with depression. Well, we also get other physical symptoms, headache, digestive problems like constipation can come. Indeed, everything with depression can be a bit sort of slowed up. With some people, they get a kind of a syndrome called retardation. The psychiatrists have a big fancy word for it, psychomotor retardation. Don't be too put off by that now. It just means that in your thinking and in the way that you move and behave, things are very slowed up. And you'll see that with someone who's very depressed, that you'll maybe ask them a question and there's this big long pause before they respond to you. And they talk more slowly, and they're just thinking more slowly, and they move more slowly, and their expression in their face isn't as reactive as it normally is. And again, it's just a feature of this whole syndrome. Everything slows up. So, remember, we're trying to ask this question of what depression is, and we've seen then that it affects us outwardly in our bodies with some of those physical symptoms. Depression, though, also causes a change in behavior. What might you see? What are some of the telltale signs that you'll see in a person's life which might indicate that they're suffering from depression? Well, very often they stop doing things. The depressed person, they stop going out, they stop meeting with friends, and of course, very often the thing that they give up first are things like hobbies, enjoyable things. Unfortunately, it's just about the worst thing that we can do when we're depressed, because really we want, as we'll see later, to try and focus even on anything which might give a little pleasure and enjoyment, to try and stir up some of those feelings again. But very often when we're depressed, we stop doing those things first. A depressed person can also become quite withdrawn. They avoid people. They avoid conversation. They maybe take to their bed and they don't get up, and the motivation isn't as great to be doing things. Lots of reasons for that. Maybe it's just because of the motivation problem. Other reason might be that they get a kind of an anxiety in situations. They feel anxious with people, don't want to face those people or have to speak with those people. Maybe they feel not worthy to meet people, or the confidence has gone, which again, as we'll see, is a feature with the depression. For whatever reason, often that withdrawnness can be a problem. As well as that, depressed people can neglect themselves. They lose interest in their appearance. They lose interest in even their self-care. They don't attend to even the personal hygiene in the way that they normally would. Again, maybe it's just that they don't feel like doing these things. There isn't the same pleasure in doing them. There isn't maybe the same energy to be able to get up and do those kinds of things. And finally then we have another, I suppose, more concerning symptom of depression, and that's self-harm. That self-harming can happen in different ways. Things like overdosing, or younger people, we see sometimes this phenomenon of self-cutting. And of course, these are the kind of symptoms that we have to take seriously and which can be quite concerning. Why do people do this whenever they're depressed? Well, again, very often it can be driven by how they're thinking. There can be a kind of a self-hatred, a self-loathing. For others, and again, quite commonly we see this with young people, there can be a build-up of tension, a build-up of very unpleasant feelings inside for all kinds of reasons, maybe in their background, and that can lead then to them taking measures like, for example, cutting themselves to relieve that. Or for others, it may be that they're an indicator of suicidal feelings, something which we'll look at in more detail next week. So then, we're trying to build up this picture of what depression is, and we've seen that it affects us outwardly, both in our bodies and in our behaviour. But depression doesn't just affect us on the outside. Depression affects us inwardly. And these are the symptoms that people don't see. And as we'll go on to find out, these are very handicapping and difficult symptoms to deal with. And I think actually it's one of the reasons why depression is such a difficult condition to cope with, because an awful lot of the suffering, an awful lot of the difficulty is on the inside. And for some people, actually, they can look quite well on the outside. But a lot of this turmoil and difficulty is underneath the surface. And part of that are these emotional symptoms. Depression affects the feelings. And we see that a lot of these symptoms quite often are better presented nearly in pictures than in words. Depression will give low mood, and it nearly goes without saying, doesn't it, that depression should cause lowered mood. But it's more than just the unhappiness that most people will feel from day to day because of situations in their lives. With depression, it's a really deep-seated sadness, a heaviness of heart. It's feeling weighed down. Sometimes people describe like a weight on their chest or on their shoulders, feeling down most of the time. For some people, that down feeling varies with the time of day. So quite commonly it can be worse in the morning, and then they find that as the day goes on, that feeling tends to lift, and by the evening time they may actually be feeling quite well. And again, that's significant, because what those people will find is that as they improve, that good period of the evening begins to creep back, and the depression of the morning begins to recede and be less severe. Interestingly, though, not everybody with depression will actually feel down or look down. There is this kind of phenomenon out there that a few people get, and they used to call it, in psychiatry, they used to call it a smiling depression. People who really look as if they're just their usual selves, but they've got a lot of the other symptoms that we've described already this evening and will describe. And yet they're smiling outwardly, they look fine, but they've got a lot of the other symptoms which would really give them this diagnosis of depression, smiling depression. Secondly, the feelings can be affected with anxiety. And again, we touched on this to some degree last week. Remember when we talked about the stress response and what happens when the body goes into that kind of alarm state. And in depression, that affects us with worry, with tension, and with a lot of those other symptoms of anxiety. The heart thumping at times, the dry mouth, the churning stomach, the sweaty palms, the feeling of faintness, and so on. People describe a real turmoil inside, like a raging sea, and it can be a very overwhelming thing. And you can imagine then that whenever somebody with depression has that, and say it's in a certain situation, like a gathering like this, well, you can imagine then how they would want to avoid it because it feels so unpleasant. Irritability is a feature of depression. Usually worse for the people around you. And the depressed person, again, will find that compared to normal, they just have a short fuse. They're snappy, They'll kind of eat the face off you for just nothing at all. And very often they're struggling with it themselves, and people around them are kind of finding it hard to cope with. But the individual with the depression, very often themselves, when things settle down, is really struggling with that irritability. And then there can be a loss of enjoyment. Nothing gives pleasure, nothing gives satisfaction. Again, we call that anhedonia. Hedonia, pleasure; anhedonia, no pleasure. Even things that are normally enjoyed, this doesn't give that same sense of satisfaction. And then finally some people get what we call apathy, which is really just no feelings at all. Things that should normally stir up good feelings don't stir up the good feelings. Things that even should make you feel in a negative way, there isn't even any feeling about that either. There's just kind of no response, a numbness, an emptiness, an apathy. And that again can be a very distressing feeling for some people. So these are some of the emotional symptoms that we get with depression. Inwardly as well, then, the depression can affect our thinking. And what we find is that how we feel colours how we think. And with depression, we find that quite often the way we feel, it kind of brings to the surface ways of thinking and patterns of thinking that are really already there. Ways of seeing ourselves and seeing life that kind of grumble beneath the surface, but very often don't come to the surface. And then depression strikes, and suddenly those ways of thinking come to the forefront of our minds. And they form what we call a preoccupation. Preoccupation, brooding. Someone with depression very often will just sit in a chair, they'll stare into space, and all the time turning over in their mind are all of these thoughts. There's brooding, there's preoccupation. What are the things then, very often, that they become preoccupied with? Well, they become preoccupied with themselves and how they see themselves. And they see themselves in a different way. Very often they see themselves in a very worthless way. My life has no value. Oh, useless. I'm a failure. My life means nothing. Those are the kind of statements that whenever you scratch beneath the surface, someone with depression will come out with. Some find that they see themselves as ugly. They don't like how they look. They don't like their appearance. For others, it comes out in a sort of a loss of confidence. Their whole self-esteem changes. Someone who's normally competent in a certain area just suddenly loses all confidence for dealing with that. Just believe that they can't handle it any longer. So that worthlessness is one area of preoccupation. Another area of preoccupation is this lacking purpose. Oh, there's no point in life. The depressed person will say, what's the point in going on? Life is too hard. It just doesn't seem worth it. And again, what they're saying there is that they've lost the goal of living. They've lost the point of living. They've lost that purpose in life. Everything's a push, and the drive has gone. Life seems to lack purpose. The depressed person doesn't only see themselves differently. Very often they see the world around them differently as well, and then they develop a very negative view of the world around them. And this comes out in them seeing people and events as against them. How they're feeling makes them see their life differently, and very often they'll interpret things in a very personal way and interpret difficulties as being against them personally. And they'll say things like, this always happens to me. They take things more personally. Someone maybe just makes some kind of innocent comment, but it's so easily then misinterpreted, taken the wrong way. And the depressed person, because of how they're feeling, they become very then suspicious often and mistrusting of people. Or then we see another thing sometimes, which again the psychiatrists have a term for. It's called ideas of reference. And what that really means is that the experience of, for example, someone with depression, they walk into a cafe and there's maybe another couple sitting over at another table having their coffee. The depressed person walks in and immediately they feel that this other couple of people are talking about them. Maybe don't know them at all, but they'll feel that these people are talking about them and are making references towards them. And there's that kind of suspiciousness. And sometimes people, whenever they're thinking like that, they can begin to wonder what's happening to their mind. But it's just how the depression is colouring how they see things. Well, this old brooding preoccupation that we get with depression, it doesn't only colour how we see ourselves and the world around us, but it colours how we see the past. And that comes out with guilt. The depressed person can feel excessively guilty about small things. One example might be, say, a man has a sick relative and maybe doesn't get to visit him for whatever reason, very busy, just doesn't get a chance to see him in hospital, but relatives out again, no problem in the relationship afterwards. Years later, the first man gets depressed and he begins to feel guilty. And he can't think of why he's feeling guilty. So what does he do? Well, he begins to go back over the past and he rakes over everything to see why he might be feeling guilty. And suddenly then he comes up with, that's it. It's because I didn't go to visit so-and-so years ago in hospital. I've left something undone that I should have done. And he feels guilty about that, and he has to go and make amends and apologise and so on. And then that kind of guilt can spread over onto other things, and then very often the depressed person will feel they have to go round and make amends and make restitution and say sorry. And it's an excessive feeling of guilt driving all of that. Well, depression also affects how we see the future. And the idea there is hopelessness. I can't see a way forward. Everything just looks black. There's no light at the end of the tunnel. Those are some of the comments that the depressed person will say. There's no hope for me. And the worst is going to happen. At this point, it is important for us to take that seriously and to, if we're in their position to do so, to check for suicidal thoughts. Again, it's something that's very important and we will come back to look at in a bit more detail next week. But asking things like, well, how do you see the future? Does it ever get so bad that you really feel you can't go on? Those kinds of questions are important to ask someone in that situation. Because there can be a risk of self-harm or indeed suicide with depression. So what we're seeing then is that whenever depression strikes us and begins to change how we feel inside, that very often then colours how we think and colours how we see ourselves and the world around us. It causes our thinking to become a little bit unbalanced, and if you like, it pushes it to an extreme. So that we see things in a very extreme kind of way. And for some people, this can become what we call a psychotic depression. Now, whenever I use the term psychotic, just to explain what that means, a psychosis or a psychotic condition is a condition in which a person loses touch with reality. And whenever that happens in their thinking, they develop a thing called delusions. And with depression, again, some of these ways of thinking can become what we call delusional, very strong, very extreme. The person can begin to think, for example, that they're just empty, that there's nothing inside them, that they're even dead inside, or that people around them seem dead and empty. And that becomes a very fixed way of thinking, and it's very hard to shift it. For others with this psychotic kind of depression, they get a thing called hallucinations. And hallucinations are just whenever we maybe hear something, whenever there isn't anything there, or less commonly we see things whenever there isn't anything there. Quite often it comes in the form of voices. And with depression, those voices, they're kind of linked in with this way of thinking. They're very negative, they're very derogatory, very condemning, and you can see how that then feeds into the whole kind of worthlessness and guilt. More severe form of depression, and very often needs quite urgent medical care treatment. Well, this is depression then. I hope then that we've seen that depression is more than just unhappiness. It's more than just having an off day. Depression is something which, as we said at the beginning, can really creep over your life and begin to interfere very much with how you live your day-to-day life. Just to say again that you don't though have to have all of these symptoms to have what we call depression. Again, it's just a number of these symptoms happening together in a strong enough way so that they're interfering with life, and you'll have what by and large we will recognize as depression. The other thing I just want to mention is that you've probably noticed, maybe as I've gone through some of these symptoms, that there's a kind of a link, isn't there, between some of them. There was a bit of overlap in some of the symptoms, and that helps us understand a little bit about how depression develops. The symptoms of depression tend to feed into one another. And as they feed into one another, they begin to cause this kind of spiraling downwards. Let me give you an example. Maybe links in a little bit to the scenario that we had last week. Let's take a man who loses his job. And he's lost his job, and as we might expect, his sleep becomes poor as he begins to think about the future. Because his sleeping has been poor for a number of nights on the trot, he's getting tired, he's beginning to feel exhausted. And of course, as happens with a lot of us, whenever we feel tired or exhausted, small problems become big problems, and we become more snappy. Well, that kind of snappiness and irritability begins to affect everybody else in the home, as it often does. And this man, as well as concern and worry about the future, he's beginning to feel guilty that at home he's presenting as this kind of Jekyll and Hyde character. He's also beginning to think of himself in a very worthless kind of way. He's lost this role now as a breadwinner in the home, and he's lost that sense of purpose that work gave him. And as all of this begins to come down, and on top of him this cloud of gloom descends, colours his thinking, and of course whenever he's feeling that way, that just reinforces all of those thoughts that he's worthless and that there's no purpose to life. And you can see then how it all begins to spiral, one symptom tumbling into another one in this spiral downwards into turmoil and the darkness of depression. Now that all sounds very pessimistic, but actually there's a little clue there as to what can help depression, because in the same way that one little thing can lead into another on the spiral downwards, by the same token, when we begin to work on one area to try and change things around, very often that can have some positive knock-on effects in the spiral, if you like, back up out of the depression. And we'll come back to that in a few minutes. So we've seen what depression is. We've found out a little bit now about how an episode of depression develops. Let's then ask the question, why does it happen? What causes depression? And let's look at some of the more common causes of depression. Family history is relevant with depression because there can be a genetic component to it. The child of someone who has had depression is about 3 times more likely than the general population to suffer from depression. So there's a genetic component to it. Now, having said that, it's important to stress that it's not inevitable that the children of someone who's depressed will develop depression. As we'll see, there are many other factors, and the genetic one is only one of those vulnerability factors. But it is there, and it's something that has been recognized. So a family history is relevant. Bigger than that, though, probably is the next point there, which is the life events. Again, something that we touched on last week. And with depression, around about 70% of cases of depression are preceded by some major happening, some major change in a person's life. And there's a certain characteristic to those changes. It's especially losses in a person's life which predispose us to depression. And I suppose that stands to reason, really, doesn't it? Things like bereavement, where there's the loss of a relationship, the loss of companionship, support, friendship, loss of a job. We've mentioned there, we've seen loss of role and routine with that. Divorce, marital separation, another quite common cause of depression. Another one is children leaving home. The old kind of empty nest syndrome that we've all heard about. And again, whenever you think about it, children leaving home does bring about quite a significant change to the home, and a major change quite often in roles, with a certain sense of loss to those whose role has been changed, particularly perhaps a mother in that situation. Moving house, another one of those losses, and we perhaps don't often think of that as a loss, but again, moving house means being dislocated from things that are maybe familiar, surroundings, people, places, and so on, and a whole change of routine and relationships, which we can experience as a kind of a loss. Illness, obvious one, loss of health, and really any unexpected change of direction in your life can predispose you to depression. And another important thing to recognize there is that it doesn't have to be just one major event in your life. Sometimes people develop depression, and you may be asking the question, well, has anything big happened in your life recently? And they'll kind of look back over the last number of months and they'll say, well, no, not really. But then whenever you question them a bit more closely, you'll see that there's been maybe a catalogue of smaller things coming together. And that's a recognized phenomenon that we call kindling. A series of smaller things that come together, or maybe some bigger thing that happened in the more distant past, and then a series of smaller things, and then the person gets depressed. And again, you kind of think, well, the really big thing happened way back there. Why did I not get depressed after that? But what's happening is that it's an accumulation of these smaller things, this kind of kindling effect. The other thing just to remember as well is that even after a major life event, there can be a gap before the depression begins. And the risk is still increased for around about a couple of months, 2 to 3 months after a major life event. So everything might have gone and seemingly resolved itself after the big change in your life, and then the depression hits and you're kind of thinking, why now? But very often it's because there's been that sort of kindling effect and the risk is greater for a period of time afterwards. Just before we leave the life events things, we said it's around about 70% of cases. It means then that there is a fair proportion of depression which doesn't have any kind of life event situated or associated with it. And that is sometimes what we call an endogenous depression. Endogenous just means that it arises from within. It's a bit like getting the flu, there doesn't seem to be any real cause for it. It just comes over you, it just hits you. And sometimes depression can be like that with no real particular explanation at all. And that's an endogenous depression arising from within. Early experiences there can also be a kind of a predisposing factor. So things that have happened way back in the distant past can leave you vulnerable in adult life to developing depression. Commonly things like childhood abuse. But also being brought up in a home where there was a significant amount of discord in the home, where there were difficulties in the relationships within the home, a lot of conflict, maybe even just a lot of coldness and not very much acceptance or warmth or love in the home. Sometimes that kind of experience in childhood can predispose someone to depression in later life. Personality. Yes, there is, I suppose, such a thing as the depressed or depressive personality. The image that I always have in my mind here is Eeyore, Eeyore out of the Winnie the Pooh kind of series, that kind of pessimistic, always looking on the dark side of things. The glass is always half empty rather than half full. I'm sure you all kind of know people like that. You don't have to look at them, just, we all know people like that. And at times we're all a bit like that, aren't we? We have that kind of pessimistic outlook. Also people actually that are easily overwhelmed by stress. People that don't cope as well with stress can be predisposed to depression. And people too that have very high standards. People that are quite rigid, have very high expectations, maybe of themselves or others. Those kinds of folk who may be a bit more perfectionist as well are possibly more prone to depression. Physical illness is also very, very relevant, and there are a number of illnesses which it's important to know that these are associated with depression. And one of the reasons why it's important to know that is that for some of them, if we treat the medical condition, the depression will lift. And one of the most common examples there is thyroid disease, an underactive thyroid. Whenever the thyroid is underactive and isn't producing as much hormone, associated with that there can be a depression. And people will find that once that is corrected with the medication, then the depression will lift. Other conditions are things like anemia, a low blood count, infections, and again we can kind of see how that makes sense. Sometimes there are flus and colds and infections that we get that leave us very washed out and tired afterwards. And again, it's maybe not a big leap in the imagination to see how that can then kind of spiral down into that depression which we saw a moment ago. Diabetes, another important one, because again I've certainly seen cases where whenever the diabetes has been stabilized and the blood sugars are under control, actually the person does feel an awful lot better. And so that's an important one to remember. Other things too, like heart attack and stroke. Quite a significant proportion of people who have had some major medical event like that in their lives can develop depression afterwards. Parkinson's disease, another fairly common condition in older people, again can have depression as part of it. Alcohol and drugs can be a cause of depression. Alcohol can cause a kind of a chronic depression. Again, it's important to recognize that even people who have managed to get over their alcohol problem and have maybe stopped drinking can find that even in abstinence and sobriety that depression lingers on and can sometimes be difficult to treat. And drugs as well. Well, again, some drugs, stimulants, will give a person quite a high, but then afterwards there's a price to pay with a crash into depression sometimes for people, a very acute kind of depression with that. Medication, again, this is important to recognize. Some tablets will cause depression as a side effect. And the key there is linking the beginning of the depression with starting the tablet. And if you have an inkling about that or think that might be the case, it's useful to go back to the GP and just to check. There are some tablets which can have depression as a side effect, things like beta blockers, which are quite commonly given for high blood pressure and other heart difficulties. Some of the tablets for lowering cholesterol, which are prescribed very commonly today, and other medications for things like epilepsy and Parkinson's, again, actually can cause depression. Finally, a previous history is also something which can predispose you to depression. around about 10 to 15% of people may just have one episode of depression and then nothing else for the rest of their lives. But for a significant majority, depression is a recurring problem, something that they battle with and struggle with in episodes on and off through their life. So, we've just looked then at what causes depression. Why does this happen? Well, let's finally now go on and spend a little bit of time just looking at what can be done to help. I think the important thing to emphasize here is that there is help. Okay, something can be done. Depression is something where help can be given and where there is treatment available. Just before we get into it all, I want to just highlight to you that there is a sort of a course of recovery. Getting over depression, and any of you that have suffered from depression will know this, is that it's not a nice straight line. Very often you'll find that from being very low to back up to normal again is a very bumpy kind of ride, where whenever things begin to get better, you get good days and you get bad days, okay? And then you get good day, good day, good day, good day, and then you get, bad day again. Very often people feel that, they get a run of good days and then an awful day. They think, I'm back at square one. And the key thing to remember whenever you're recovering from depression is not so much the day-to-day change, but the trend. Okay, it's that the overall trend is upwards. And so it's important not just to look at how you've been today or yesterday or the day before, but to ask, well, what's it been like over the past week or over the past month? And to see that overall trend of recovery. Well, here are some brief points then about the treatment of depression. First thing I would say is that it's important to see a doctor. We've already seen that physical illness can present as depression or can be an effect of it, and so we need to have that excluded in some cases. Medication can cause depression. And of course, even this whole area of risk with depression, it's very important that we have all of that assessed properly. When should I seek help is a question that very often people will ask. And I suppose the principle is, well, the earlier the better. And certainly if you're beginning to get any of those thoughts of hopelessness and life not being worth living, or thoughts of harming yourself or suicide, certainly at that point we need to seek help urgently. I'm going to just jump down and talk for a few minutes about medication, then come back up to this next one, because basically the treatments of depression fall into two big categories. One is talking and the other is tablets. Okay, just in broad terms, those are the main ways of treating depression. With regards to the tablets and the medication, in milder cases of depression, in other words, those cases of depression that have fewer of those symptoms that we mentioned at the beginning, or where they're milder and they're not interfering with life as much, a GP will probably advise a sort of a watch and wait kind of approach, and may even recommend a bit of recreation, a bit of exercise, because there is actually fairly good evidence out there that exercise, routine structure and so on, those kind of things can be very helpful at a practical level with depression. Medication, however, can be of benefit in the more moderate to severe cases of depression. There is a good reason for using medication because with depression, and again this is a question that people very often ask, is there a chemical imbalance? Is that what causes the depression? Now, what we do know is that there does seem to be some change in the chemicals in the brain, and you'll all, or most of you will have heard of things like serotonin, they're kind of mentioned in the media these days. And there does seem to be at the nerve endings in the brain a depletion of this substance called serotonin. What we don't know, however, is whether that's a cause of the depression or an effect of the depression. And it may well be that the latter is the case, that actually it's the way we're we're thinking and behaving, and how the depression has got us down that spiral, has begun to feed back, if you like, into the chemicals in the brain. And we're not sure whether it's cause or effect. And you get into this kind of chicken and egg sort of situation. But we know that there seems to be a depletion, for whatever reason, of this chemical. And what the medication does is that it comes in really and just restores the balance there, where there is that depletion. Well, the medication does have, they can have side effects. Not everybody, though, gets side effects, and it's really just a bit of trial and error. For a lot of people, it's things like nausea, diarrhea, stomach upset, bit of dry mouth. Sometimes it can interfere with your sex life as well. And for others, it's sedation and sleepiness. And again, it's this trial and error to see which of these side effects one will get. Very often, though, they do resolve after a number of days, and sometimes trying to weather the first sort of week or so, and those side effects may pass. Another question people often ask about the tablets is, are they addictive? What we have recognized is that there can be what's called a discontinuation syndrome. In other words, you should never tell anyone just to stop their medication. That can be a very dangerous thing to do, because stopping medication abruptly can give rise to very unpleasant physical symptoms, which can cause some harm. Things like electric shock, feelings in the arms, and a very unpleasant restlessness and so on, which can leave a person feeling very unwell. And if they're already struggling with depression, it will just add into all of that. So antidepressants have to be stopped very, very gradually over usually a period of weeks. So certainly you have to be careful about stopping them quickly. However, antidepressants, they don't give you any kind of buzz whenever you take them. And you'll not find that you're taking increasing amounts of them to get the same feeling with things which you do find with things like alcohol and some other medications. So they're not addictive in that sense. They work for around 30 to maybe 40% of people. So it's only kind of in the region of 1 in 3 who will benefit from antidepressants. The problem is that we can't predict who's going to benefit and who isn't. And so again, it's a bit of a lottery, and we have to try them out and see if someone is going to benefit from them or not. They tend not to shorten an episode of depression, but what they do is that they do relieve you of some of the symptoms, and so they make the episode of depression more tolerable until it does resolve. So that's a little bit about the medication. Just before we leave the medication, I should also mention ECT. I made somebody jump there, I think, by hitting the microphone. ECT is the old shock treatment that you'll probably have heard of, and you'll have had all kinds of images maybe in your minds of what that's like. It's not really as barbaric at all as people sometimes portray it to be. It isn't used, though, these days as often as it would have been in the past. And what happens is that the person gets a very small amount of electricity applied to the head, to the brain, while they're under a very light anesthetic, the kind of anesthetic you get for maybe a dental procedure. And what that does is it induces a very brief seizure for a person, and it seems to change the levels of chemicals in the brain, and maybe more so actually it's to do with the hormonal system and changing that, and that's how it tends to work. It can be a very effective treatment in severe forms of depression, particularly those forms of depression, a bit like the psychotic depression that I mentioned a few minutes ago, or depression where the person has become so slowed up that they're not eating or drinking in the way that they should, and perhaps even their physical state is at risk, and ECT can be very useful in that situation. In fact, there are some instances in which ECT has been life-saving and managed to help someone very quickly out of a depression which could have been life-threatening because they weren't eating and drinking, and there was an upset to the various chemicals in the body because of that. So that's just a little bit about ECT. Let's move on and talk then about these talking therapies. Well, the talking therapies, there's a huge range of them, from the more counselling, support end of things, right through to the more formal therapies. For example, I've given an example there, one of the therapies that's flavour of the day at the minute, CBT, or cognitive behavioural therapy. And I just want to mention it because it's one that you may well have heard of. Don't again be put off by the big words. It really just means a therapy or a treatment that affects the thinking, the cognitions, and the behaviour. Which makes sense, doesn't it? Because as we saw earlier, depression does affect both the thinking and the behaviour. And so CBT can be one of those useful therapies in depression. One of the things, though, whatever help or support someone gets in the talking end of things, one of the things that we have found is that the crucial thing very often is the therapist or the person who's giving the counselling or the support, and that relationship that they have with the person that they're working with. And very often, if the depressed person perceives the therapist or the counsellor as someone who is helpful and has empathy with them and is willing to share their burden, well then that can be a very significant thing. So someone coming alongside to help who is sincere and genuine and patient and willing to understand, that can very often be the crucial factor, regardless of what kind of therapy a person gets. One place to start in these talking therapies, and some of them do this, is by setting some goals and tasks. Because whenever a depressed person gets very depressed and the motivation is gone, their day can become very unstructured. They're sleeping in perhaps because the night has been so restless. There doesn't seem to be anything to get up for because they've stopped their activities. Their motivation is shot. They don't feel like doing anything because of the depression. And the whole day becomes very unstructured. And it feeds into the whole spiral of depression. And so one way that all of us can begin to help in a very small way is by helping the depressed person to set some very small, low-level goals and tasks to do, and to begin to introduce a bit of structure to their day, even in terms of getting up at regular times, even very basic steps like getting up, getting dressed, getting washed, and having some very low-level tasks that are feasible and realistic for that person to be able to manage. And what you find is that even if you can begin to encourage a person in that way, is that they begin to then get a little bit of sense of hope that there's a way through this, that sense of purpose returning again, that there's something to get up for, even if it's something very small, even if it's just to get up for that regular walk every morning, or that visit from someone coming in. That sense of purpose, something worth getting up for, and it can restore some of that sense of worth again to a person, and can just give them that little bit of hope. And again, as we said at the beginning, those little small steps, one adding into the other, can begin to help out of the spiral of depression. And then adding in medication can be just something else which will feed into that and help us up out of the spiral. So then that's the talking therapies in a very broad kind of way. Another point then is reducing the stress as well. We talked about that in detail last week, identifying the stress. Is it a work issue? Is it a relationship issue? And then introducing change to that to try and help. Let's take just a moment or two to look at this whole area of what we can do to help. Some of you may be here this evening and you know someone who's depressed, or you're living with someone who's struggling with depression. What can I do to help? It can be very difficult, as we've seen, for the sufferer of depression, but equally it can be stressful and difficult for the carer and for those who are close. And the question very often is, well, what do I do and what can I say in this situation which will help? Just a few very basic points. One is be a friend. Being there is a lot more important sometimes than we think. We may think we're not doing much, but actually just being present and not giving up and not drawing back from the person can be a tremendous support, even if they don't express that to you. Listening. Don't underestimate the power of listening. The depressed person is very often relieved to be able to share their feelings with someone, because quite often it's locked away and they feel very ashamed of how they're feeling inside. And as we listen, it can be a great relief for them, but also develop our understanding of where they're at. Helping practically. It can be hard to find the right words, can't it, whenever we're helping someone with depression. So help practically in the kind of way we mentioned there, setting small steps, small goals for the person to reach, and being patient with them. We've seen with the course of depression that it can be 2 steps forward, 3 steps back some days. So be patient and try to see the overall picture. Don't be too quick to judge. I think it's somewhere where we all struggle, isn't it? A lack of motivation, fatigue, that everything's slowed up, that retardation. Well, to the rest of us it can just look like laziness. Irritability and worry can just look like selfishness. But don't be too quick to judge. Very often the depressed person is struggling with all of this themselves, and really they don't want to be like that, and they're very aware that they are like that. And so don't be too quick to judge them. Don't be afraid to ask about suicide if you feel able to and you're in a position to do that. There's a myth out there that by asking you increase the risk. Very often if someone's thinking in that way, they're very relieved to be able to share it with you, so don't be afraid to ask. Encourage them to seek help, as we've mentioned, and do encourage hope. I think that's very important. Depression can be an opportunity to ask, what does this say about my life? It can force us to look at ourselves and look at our lives. Time to reevaluate things, our priorities. Does something in my life need to change? Are there deeper issues? Where is my life going? What's really important? Why am I here? If you go to the World Health Organization website and look up the leading cause of disability in our world today, you find that the answer, believe it or not, is depression. The leading cause of disability in our world today. What is it about us, and what is it about our world that makes depression one of the biggest health burdens that we face? Now let's think about this a bit more deeply. Why is it that a condition like depression is competing with cancer, HIV, TB, malnutrition, all of those other big conditions that we think about in this world? This condition in which people feel sad and in which they feel there's no purpose to life, and they feel guilty about the past and that there's nothing solid to look forward to in the future. What is it about this world? What is it about this life? What is it about us that makes depression such a disabling factor in the world? Well, depression, as we've seen, brings to the surface issues that are already there deep down. And so that brings us to the question of what is it about us? What is it about our makeup that makes us question then our worth and our purpose and our hope for the future? What's gone wrong? What's missing? And what's the real answer? Well, it stands to reason that what is missing there is something that gives purpose to living, something that removes the guilt, something that gives us a firm hope for the future, and something that will give us a true sense of our worth and our significance in this life. And whenever you think about it, it's very hard to truly encourage a depressed person who's dealing with those issues in their thinking without a real sense of purpose and hope and dignity. Let me finish by telling you briefly about a man who found the answer. This was a man who had responsibility, a man who had a certain position in life. He was in a prominent position in his community, the kind of man that people looked up to for direction. He was a kind of a leading light amongst his folk and community. And then something happened. We don't know all of the details, but reading between the lines, he faced some kind of major change in his life, along the lines of what we saw earlier. It involved opposition from other people. He had received unfair treatment. He had lost his position. And whatever the exact cause of all of this, he had become depressed. And it had begun to affect him in every area of his life. And when he was in that situation, he then did what people very often do and can find helpful. He wrote his experiences down. He talked about how it affected him, and he talked about how he coped. And he put it into a song or a poem. And it's recorded for us in the Bible. We see it in the book of Psalms, which is a kind of a song book there in the middle of the Bible. Psalm number 42 and the following one, Psalm 43. They seem to be one song written by this man. And they describe his experience. And in these songs, he discusses how he was cast down, feeling down, depressed. He describes many of the symptoms, if you look at it for yourself, many of the symptoms that we've talked about this evening. And the question is, how did this man deal with his situation and the depression that it led him into? Where did he find that sense of purpose, that hope, that joy again? Where did he find the answer to those really big questions, those life issues that depression throws up for us? Let me quote you a little bit from this song that he wrote. He says this, he says, "Why are you in despair, O my soul, and why are you troubled within me? I will put my hope in God," he says. "I will praise him again, the help of my countenance and my God." And when he's saying there, the help of my countenance, he's saying something which will change my countenance again. Or another way of translating it is my salvation, or my Saviour and my God. And the bottom line is this, for this man, that it was in God that he found his hope. It was in God that he found his help, his well-being, his health, his salvation, as he puts it. In God, he finds his true sense of self-worth, his purpose for getting up each day. In God, he finds that the past can be put right and the guilt removed. It's in God that he finds a sure and certain hope for the future. In other words, it's in God that he finds exactly what he needs. He finds answers to the exact issues that depression raises for him. And that's what his salvation was. That's what salvation is. God was his help. And I guess the question is, well, how can we here today, thousands of years later, how can we find that help? Now, don't get me wrong, they have their place. But ultimately, we don't find answers to these kinds of questions in things like medication or self-help or even a psychiatrist. They do have their place and they are important, but they don't give answers to these ultimate questions. And what we learn from the Bible is that it's in Jesus Christ. It's in a person, Christ, that we find this way to that kind of help and salvation that this songwriter was talking about. It's in Christ that we find that guilt is totally removed and dealt with. It's in Christ that we find that there's a purpose to life, a reason for living, and a firm hope for the future. Now hear me carefully, because it's not to say that a Christian will not get depressed. That's not at all what we're saying. If the psalmist in that psalm is telling us anything, he's saying that someone who's trusting in God can suffer from depression. But what he's also teaching us is this, is that if they do, they can go to their God, and whilst they may not feel it at that point in time, they can know for sure that the guilt is washed away, and that the purpose for living is established, and that they do have a true sense of self-worth, and that in their God they do have a firm hope for the future. And the question, I think, for all of us this evening is, do we know this God? And do we know that help in our lives? Thank you very much.